Bonjour et merci de vous être joints à nous aujourd'hui. À tous les travailleurs de la santé de première ligne, nous reconnaissons que c'est un temps très difficile pour vous. En l'honneur de la Semaine nationale de soins infirmières, remercions les infirmières et les infirmières à travers le Canada qui font un travail exceptionnel à tous les jours et particulièrement lors de la lutte contre cette pandémie mondiale. Merci pour tout ce que vous faites pour nous garder en santé et en sécurité. Vous êtes de vrais héros. So, to all of Canada's frontline healthcare workers, we know that this is a particularly challenging time. This is National Nursing Week, and I'd like to thank all of the nurses across Canada who are doing exceptional work every day, and in particular during this fight against the global pandemic. Thank you for everything that you do to keep us safe and healthy. You are true heroes, and we appreciate it so much. So today we will hear from Canada's Chief Public Health Officer, Dr. Theresa Tam, the Deputy Chief Public Health Officer, Dr. Howard New, le Président du Conseil du Trésor, Jean-Yves Duclos, and of course our Minister of Health, Patty Hajdu, is here to answer your questions as well. Dr. Tam, please.
Bonjour à toutes et à tous. Good afternoon. I'll start with the latest numbers on COVID-19 in Canada. There are now 69,156 confirmed cases, including 4,906 deaths, and over 32,400 or 47% have now recovered. Labs across Canada have tested over 1,118,000 people for COVID-19 to date, with about 6% of these testing positive. In the past week, we've tested an average of 26,000 people daily. These numbers change quickly and are updated regularly on canada.ca/coronavirus. We are at the start of another week after celebrating our mothers and caregivers, whether with us in our home, just a virtual connection away, or beloved and unforgettable in our memories. We all share the understanding of the power of their nurturing. So my weekend reflection was on the fundamental human need for this most powerful force of good. Nurturing is that silent catalyst that speeds up the healing of our cuts and scrapes, calms our fears, and gives us reassurance that everything will be okay. This brings me to a very special week of recognition and acknowledgement of some of the other important nurturers in our society. Today marks the beginning of National Nursing Week. We all know that nurses deliver expert care with that special power of nurturing, and we have been very aware of the many sacrifices they have made to be there for their patients in every area of healthcare during this crisis. But their expertise and impact goes far beyond this, spanning every area of health services, from education to the development of standards and guidelines, the delivery of public health programs like vaccination, the implementation of infection prevention and control, and contributing to research and innovation. Nurses contribute to wellness everywhere, and we are also very much better for it. So this week, let's all thank Canada's nurses. Join a 7 p.m. cheer from your driveway. Draw a thank you sign for healthcare heroes in your community, or shine a light in a window for all nurses on Tuesday night, because Tuesday nurses everywhere are commemorating the 200th anniversary of the birth of Florence Nightingale, who revolutionized the field of nursing. It was a revolution that started small, implementing hand washing and hygiene practices to save lives by preventing the spread of life-threatening infections. Then slowly, but with unshakable purpose, she raised the standards and profile of nursing and put an indelible focus on the education of nurses. So in appreciation for the nurturing, daily sacrifices, deep expertise, and unshakable professionalism of nurses everywhere, shine a light in your window on Tuesday night. Thank you. Merci.
Okay, thank you very much, Dr. Tam. Et maintenant, je donne la parole à Dr. Howard New. Dr. New, s'il vous plaît.
Merci et bonjour. Comme d'habitude, je vais commencer par vous donner les derniers chiffres sur la COVID-19 au Canada. Il y a maintenant 69 156 cas confirmés, dont 4 906 décès et plus de 32 400 personnes rétablies, soit 47 %. Jusqu'à ce jour, des laboratoires partout au Canada ont analysé les tests de dépistage de la COVID-19 de plus de 1 118 000. Environ 6 d'entre elles ont obtenu un résultat positif. Au cours de la dernière semaine, en moyenne, plus de 25 000 personnes ont été soumises à un test de dépistage chaque jour. Ces chiffres changent rapidement et ils sont mis régulièrement à jour dans le site canada.ca/coronavirus. Voilà que nous entamons une nouvelle semaine après avoir rendu hommage à nos mères et à nos soignants et soignantes, qu'elles soient à la maison avec nous, à l'autre bout de la connexion virtuelle, ou encore qu'elles soient chéries et inoubliables dans nos souvenirs. La force de leur soutien émotif n'échappe à aucun d'entre nous. Ainsi, en fin de semaine, nous avons réfléchi à ce besoin humain fondamental que nous avons pour cette puissante force du bien. Le soutien émotif est cet élément silencieux qui accélère la guérison de nos coupures et éraflures, qui calme nos peurs et qui nous assure que tout ira bien. Cela m'amène à vous parler d'une semaine toute spéciale dont l'objectif est de faire reconnaître le travail des soignants et des soignantes les plus importants de notre société, soit la Semaine nationale des soins infirmiers qui commence aujourd'hui. Nous savons tous que le personnel infirmier prodigue avec expertise des soins empreints de ce soutien émotif si spécial et nous avons tous été témoins de nombreux sacrifices qu'ils ont fait, ces personnes, pour accompagner leurs patients dans toutes les sphères des soins de santé pendant cette crise. Toutefois, leur expertise et leur influence ne s'arrêtent pas là. Elles rayonnent dans tous les secteurs des services de santé, de l'éducation, l'élaboration de normes et des lignes directrices, à la prestation de programmes de santé publique comme la vaccination, à la mise en œuvre de pratiques de prévention et de contrôle des infections et à la contribution à la recherche et à l'innovation. Le personnel infirmier contribue au bien-être partout où il va et nous nous sentons beaucoup mieux grâce à eux. Cette semaine, prenons le temps de remercier le personnel infirmier du Canada en participant à 19 heures à des encouragements à partir de votre entrée, en fabriquant une affiche pour remercier les héros des soins de santé de votre communauté, ou en illuminant une fenêtre en leur honneur mardi soir. Pourquoi mardi? Parce que les infirmiers et les infirmières de partout célébreront le 200e anniversaire de naissance de Florence Nightingale, qui a révolutionné le domaine des soins infirmiers. Cette révolution a eu des débuts modestes, avec la mise en place de pratiques d'hygiène et de lavage de mains pour sauver des vies en limitant la propagation d'infections potentiellement mortelles. Lentement, mais avec une détermination inébranlable, Florence Nightingale a rehaussé les noms et le profil de la profession infirmière et laissé une marque indélébile sur l'éducation du personnel infirmier. Par conséquent, en reconnaissance du soutien émotif, des sacrifices quotidiens et du professionnalisme inébranlable des infirmiers et des infirmières partout, illuminez votre fenêtre mardi soir. Merci.
OK. Merci, Dr. Knou. Et maintenant, je donne la parole à Jean-Yves Duclos. Jean-Yves, s'il vous plaît.
Merci, Christia, et bonjour tout le monde. Le message principal du premier ministre ce matin, c'était un message de protection, entre autres en mettant en place un nouveau programme de crédit d'urgence pour les grandes entreprises. Premièrement, protection pour les travailleurs en s'assurant du respect des conventions collectives et en s'assurant du respect des plans d'investissement pour garantir les emplois, même dans la situation de crise que nous vivons. Deuxièmement, une protection des contribuables en s'assurant de mécanismes solides pour des règles de gouvernance appropriées dans les conditions d'urgence que nous vivons et des règles de compensation des propriétaires et des gestionnaires qui sont aussi appropriées. Protection aussi des retraités en évitant la faillite de ces grandes entreprises et en s'assurant de la bonne gestion des plans de retraite de ces grandes entreprises et aussi la protection de la résilience de notre économie lorsque l'économie sera de retour sur sa lancée. On espère que cette économie sera durable et donc on s'attend à ce que les grandes entreprises qui seront appuyées démontrent des plans de lutte contre les changements climatiques et environnementaux qui soient solides, ainsi que des plans qui vont garantir le maintien et le développement des chaînes d'approvisionnement qui existent entre ces grandes entreprises et les petites et moyennes entreprises, qui sont le tissu économique de base de notre économie. Tout ça dans un plan donc d'urgence qui se veut à la fois équitable, qui se veut aussi transparent et qui se veut universel. Merci, Christia.
OK, merci beaucoup, Jean-Yves. Et on est prêt à répondre à vos questions, Carl, s'il vous plaît.
Thank you, Deputy Prime Minister. Just a reminder that we have a hard stop at 1 p.m. today, so we'll start on the phone with 3 questions, 1 question, 1 follow-up, and then we'll turn to the room. Operator.
Thank you. Merci. Our first question, notre première question, nous vient de Lina Dib avec la presse canadienne. Please go ahead. À vous la parole.
Oui, bonjour. Monsieur Duclos, j'aimerais ça que vous essayiez de m'expliquer la logique pour l'aide aux grandes entreprises. Si on prend l'exemple des entreprises aériennes, on sait que ça ne va pas aller mieux pour elles dans un avenir rapproché ou même à moyen terme, étant donné la situation. Alors, quelle garantie vous avez que tout cet argent que vous êtes en train de dépenser pour les maintenir à flot ne va pas simplement tomber dans le dallo parce qu'au bout de l'exercice, elles vont mettre des gens à pied, elles vont diminuer leurs affaires?
Merci pour la question. On s'entend que ce sont des prêts d'urgence, ce ne sont pas des chèques en blanc, donc des prêts qui sont là pour assurer et appuyer la transition en situation de crise pour éviter justement que certaines de ces grandes entreprises qui ont un avenir à terme ne soient pas obligées de mettre à la porte des milliers de travailleurs et qu'ils ne soient pas obligés non plus de couper les chaînes d'approvisionnement importantes qui existent entre ces grandes entreprises et les petites et moyennes entreprises qui sont, comme je le disais, l'engin économique principal de la croissance économique au Canada et au Québec, certainement. Donc, c'est pour faire en sorte de protéger, le temps de la crise, le tissu économique majeur dont on a besoin pour relancer l'économie. Et on sait que ça passe, entre autres, par un plan de prêt d'urgence auprès de certaines de ces grandes entreprises. À nouveau, ce n'est pas un chèque en blanc. Ces grandes entreprises vont, dans la plupart des cas, préférer continuer à obtenir des liquidités des marchés financiers traditionnels, mais dans certains cas, il est possible que ces entreprises fassent appel au gouvernement canadien, mais il va y avoir des conditions importantes à respecter.
En suivi,
oui, j'avais compris. Oui, merci. J'avais compris que c'était des prêts, M. Duclos, mais j'aimerais que vous m'expliquiez en particulier le concret d'une entreprise aérienne. C'est quoi l'intérêt du gouvernement de mettre de l'argent disponible pour une entreprise aérienne? On a vu des entreprises automobiles ne pas rembourser des prêts de gouvernement et mettre des gens à pied au bout du compte. Alors, comment est-ce que ça peut être logique d'aider financièrement des entreprises aériennes quand on sait que à court et à moyen terme, peut-être même à long terme, leurs affaires vont aller en diminuant?
Bon, il y a une chose qui est claire, et vous le dites très bien, c'est qu'à court terme, on sait très bien que ces entreprises aériennes vont continuer de connaître des pertes importantes. Mais ce qu'on sait aussi, c'est qu'à plus long terme, on aura besoin d'entreprises aériennes solides au Canada. Et d'un point de vue structurel et d'un point de vue national, ces entreprises aériennes et de transport en général vont être appelées à jouer un rôle majeur pour de nourrir le tissu économique du Canada. Il serait vraiment très, très dommage, non seulement à court terme, mais aussi à plus long terme, si on se privait au Canada d'entreprises aériennes et de transport plus généralement solides pour un jour là, nous sortir de cette crise.
Merci, Monsieur le ministre. Opérateur, prochaine question, s'il vous plaît.
Thank you. Merci. Our next question, notre prochaine question, nous vient de Ryan Tumulty avec le National Post. Please go ahead. À vous la parole.
Yeah, hi there. This question's for Dr. Tam or perhaps Minister Hajdu. I'm working on a story and I've been talking to people in the health industry here about Canada's ability to produce large quantities of vaccine when or if one is found for COVID-19. I'm wondering if that's a concern for you, if you think the resources are here. I know Canada does produce a lot of vaccine, but those markets those factories are already full of other orders.
Well, thank you very much for the question. And in fact, that's part of the work that we've been doing in terms of working with promising companies across the country, particularly when it comes to vaccine production. Certainly, we have a ways to go. As you know, there is quite a bit of work to do in the space of vaccine creation and then production, but that is certainly something that we're working on. And my colleague, Minister Baines, has been extremely active in this space, making sure that Canadian companies who have either the capacity or the desire to do that have the supports from our government to quickly ramp up. Maybe I'll turn to Dr. Tam to speak a little bit more about where the international community is at in terms of vaccine development.
Well, I think we're still in this sort of relatively early stage where there's a lot of research, which is great news. So I would say over 100 sort of different candidates being looked at right now as potentials, some going into sort of early stage clinical trials. So it is still early stage. But nonetheless, we are engaging all the capacities in Canada to have a look at what is in the realm of the possible. So you don't actually have a sort of lead candidate vaccine yet, but we are absolutely monitoring every one of these and looking at domestic capabilities linked to it. So it is a very rapidly evolving setting, but we're also looking at all the way downstream to, well, when you actually have to vaccinate the population, you have to look at all the supply. So really the whole pipeline from beginning to end is being looked at from a preparedness perspective. But right now, you can't actually say, here is the vaccine that is going to be the most successful. That is still undergoing evolution globally, but we're part of that research internationally. So I think, I think we need to look at every option. Some of the investments that Canada puts in may not pan out to be, in the end, a successful candidate, but we still need to contribute right now and maximize all of our options.
Ryan, follow up?
Yeah, I just wanted to ask too, when I spoke with people in the industry, they say, for example, Canada makes most of its own flu vaccine every year. But there's obviously, well, one, only about 40% of Canadians get the flu vaccine, so this order would be presumably much larger, but also those factories are tied up making that flu vaccine. I'm wondering if, as a public health measure, you'd consider reducing the amount of flu vaccine we make one year to be able to make more COVID vaccine, should we get there, obviously.
I think, it's dangerous to think about things in a zero-sum way like that. I think we can't keep our eye off influenza as highly contagious and also leading to thousands of deaths across Canada. And of course, coincidement of the flu season with a second spike of COVID, for example, could be very difficult for our healthcare system. So from my perspective as health minister, I don't think what we would want to be in the position of having to do is decrease the production of an extremely valuable, extremely important vaccine to increase the production of another. What we're looking to do is expand the capacity and have companies across Canada that can produce, the potential COVID vaccine. I'll also just point out that I think it's really important that we work with the international community on the COVID vaccine. As we know, no country is safe as long as there is one case of COVID, and so Canada has been aggressively working in partnership and including contributing financial resources to the acceleration of discovering a vaccine and the eventual production of one.
I would just add that it's not a very simple analysis because the COVID-19 vaccine, whichever is a potential candidate, may not be grown on the same platform as the influenza vaccine. So, for example, if you have an egg-based influenza vaccine platform, that might not be how your COVID-19 vaccine is going to be produced. So it depends on the technology as well.
Thank you, Dr. Operator. Next question, please.
Thank you. Merci. Our next question, notre prochaine question nous vient de Raymond Fillon avec TVA. Please go ahead. Your line is now open. À vous la parole.
Oui, bon après-midi. J'ai une question pour M. Duclos. J'aimerais faire un suivi, une question qui a été posée tout à l'heure par une collègue au premier ministre au sujet du déconfinement. M. Trudeau a dit, dans le doute, restez chez vous. Alors ma question, si je ne rentre pas au travail parce que j'ai des doutes sur la sécurité, etc., est-ce que je peux ou non continuer à percevoir la PCU?
Bien, comme vous le dites très bien, nous sommes dans une situation où le doute et l'insécurité sont majeurs dans beaucoup de foyers, c'est dans l'esprit de beaucoup de travailleurs. Et dans ces circonstances, bien, la règle de base, c'est d'être en relation avec son employeur. Dans les cas appropriés, d'avoir un appui, par exemple, des agents de santé publique dans les provinces où on habite, pour faire en sorte que toute crainte soit résolue par une discussion appropriée avec son employeur. C'est l'objectif principal, c'est non seulement d'assurer la sécurité des travailleurs, mais aussi le sentiment de sécurité des travailleurs. Comme travailleurs, on sait très bien qu'une bonne partie de notre bien-être individuel dépend de notre bien-être au travail et ce contexte difficile qui crée à la fois des doutes et de l'insécurité doit être reconnu par les travailleurs mais aussi certainement par les employeurs. Et on s'attend donc à une relation appropriée dans ces contextes de travail.
Raymond,
Donc, si l'école où je travaille, ou l'usine, ou peu importe, rouvre ses portes, je dois m'entendre avec mon employeur, mais qui décide en bout de ligne si j'ai droit ou pas à la PCU, advenant que je refuse parce que moi, j'estime que c'est pas sécuritaire ou j'ai des craintes?
Bien, c'est justement, vous dites très bien, si j'estime que j'ai des enjeux de santé et de sécurité au travail, j'ai aussi la responsabilité d'en parler avec mon employeur et d'en parler avec les responsables et les experts de la santé publique si jamais cette discussion n'est pas aussi importante, n'est pas aussi satisfaisante que je le veux comme travailleur. Donc, c'est la condition de base, c'est que ces relations employeurs-employés doivent se faire correctement entre les employeurs et les employés. La prestation canadienne d'urgence est là pour aider, appuyer financièrement des millions de travailleurs qui n'ont pas cette capacité d'être au travail de manière sécuritaire, dans le cas des relations que je viens d'expliquer, ou qui doivent prendre soin d'un enfant à la maison, ou qui ont perdu leur emploi en raison de la COVID-19.
Merci, Monsieur le Ministre. On va passer aux questions dans la salle, starting with Mike from Global.
Thank you. Mr. Haidu, we just had Mental Health Week, and I'm wondering, how concerned are you about a secondary mental health, like echo pandemic, that could happen because of all this?
Well, thank you very much, Mike. And it's a great question. We did just have Mental Health Week, and we know that it's not just a secondary wave. It's actually happening right now, that many Canadians are experiencing distress in proportions that we haven't seen in a very long time, whether it's anxiety or depression, increased domestic violence, increased substance use. And that's why we've been so focused on making sure that we don't wait until the resolution of the pandemic to provide resources, but rather they're available right now. And I've talked quite a bit about those resources. I'll just remind Canadians that you can have access to free support through the Wellness Together portal available through canada.ca/coronavirus. But also that site has a number of useful self-assessment tools, resources that you can use on your own, and then connections to paid professionals, whether it's by text or phone. We've also increased money to transfer to provinces and territories, and for both treatment, by the way, as well as mental health supports. And that's in addition to our previous contribution through transfer increases in the last mandate. But there will be more to do, and we know that this secondary pandemic, if you will, is just as in many ways. As a matter of fact, I would say it's just as urgent as this one, because of course people are struggling for a whole bunch of reasons, including our young people, and we need to be all focused at every level of government to help people manage through these difficult times.
Thank you. And you talked about the Wellness Together portal, and I'm just wondering, does it have enough supports there? Do we need to do other stuff? Is there enough funding? Is there anything else we could do better?
Mm-hmm. So far, I've heard good things about the Wellness Together portal, and I know that provinces and territories also have their own digital and online tools, as well as access through a variety of different means to professionals in their own jurisdictions. I think there's always more to do to understand what's working and what's not working, and I think the challenge, having come from this sector in some ways in my past, the challenge is that oftentimes there isn't the diversity of tools available for people. For example, the way that we treat substance use is pretty standard, and there are a few different diversions of ways to treat substance use, but there's not the variety that exists that necessarily meets people where they're at. And that work has to continue. And I'm looking forward to having those more fulsome conversations with other provinces, with territories, with providers about how we can all do a better job talking about mental health and mental wellness. I think we also have to, as a society, continue to work on breaking down barriers to talk about mental health in a way that doesn't create that barrier of stigma that still exists for people to talk about how they're feeling. I mean, many people are feeling sad and lonely and scared, and those are okay feelings and very normal feelings to have. And so I think we have to continue to encourage one another to reach out and to speak to our families, our friends, and professionals when we need to. Thank you.
Rachel?
Rachel Haynes from CTV National News. My first question is for Minister Hajdu and Dr. Tam. Schools in some areas of Quebec are opening today, even though the numbers there are still relatively high. How concerned are you that kids right now are going to be used as guinea pigs in this reopening that we're seeing, and does that concern you?
Well, I think as we've all said, and all the chief medical officers agree, you have to do things slowly and cautiously. So I think the Quebec Public Health authorities, I'm sure, monitoring this extremely closely to see what the initial school opening would be like from a COVID-19 perspective. But as we just talked about mental health and other aspects of secondary effects, they're also monitoring, that side of things too, not just illness. And it's a complex piece of decision making, but also it's in some ways, have to support parents and individuals for making that decision, and also teachers. And so kids are connected to teachers and their families could be connected to grandparents, for example. So individual situations of risk, I think, are actually a bit different, and that needs to be looked at a more local level. But for sure, I think we know that children on the whole, particularly younger kids, do exhibit milder symptoms and have less of a severe outcome. So I think that goes into one aspect of it, but it is, I know, is a balancing between that and the need for kids, particularly vulnerable kids. I think that's, I know that in the public health domain, people are concerned that closing down schools can only impact those most vulnerable the most. So those are the kids, I think, that they're most seized with. The other thing is that children of essential service workers as well that need maybe some support from a school perspective.
Minister Hajdu, do you have anything to add?
I think Dr. Tam's covered it well. Thanks.
And as a follow-up to, we are seeing some very large cities that are opening up, like Toronto for some curbside pickup. But there are still, again, high number of cases there, more so than in other places of the country where they are not reopening yet. Even New Brunswick had pushed back some days of school opening. So are you concerned about this perhaps imbalance of openings that we're seeing across the country?
Well, thank you very much. I think that each jurisdiction is using the guidance framework that the provinces and territories with the Prime Minister worked out to make their own jurisdictional decisions based on the complexity of considerations that Dr. Tam has outlined. These are difficult decisions, and of course, premiers and local politicians are weighing decisions about how to resume some functioning of their communities while also protecting people's wellness. And I think, as Dr. Tam talked about, the decisions are being driven through epidemiology that's very local in its context. and through a risk assessment process at the provincial level. And I think when Dr. Tam talked a couple weeks ago about the downside, coming down the curve, coming down the peak, I think that's where we're at. I think all premiers and all municipal leaders understand that there will be a period of adjustment and that we will have to be taking these decisions, carefully monitoring the outcomes of these decisions and adjusting them. And I think we can anticipate that there will be adjustments as we go through the next phase. Because, of course, this is a whole new way of behaving, not just for leaders, but also for the citizens that live in those communities. I think there are some very simple messages that Canadians can take with them always, no matter which jurisdiction, which is wash your hands, don't go anywhere if you're sick, and make sure you keep your distance, your 2-meter distance from people, and give people distance when you're out in the community. And I think that will help also to reduce risk for community. Thank you.
Tonda?
Good morning. Minister Freeland, the Premier of Ontario, Doug Ford, on Friday was very adamant. He doesn't want to see the U.S. border reopened anytime soon. Can you address his concerns about that, and given that the agreement, I guess, comes up in a week? And very specifically, he said, and if you go about relaxing restrictions at borders for travel, there needs to be tenfold screening at airports and whatnot. So what plan has your government got in place to address those concerns?
Thanks for the question, Tonda. We had a very good conversation with the premiers on Thursday at the now weekly First Minister's call about borders in general and the Canada-US border in particular. We are really daily, even hourly, reviewing and working on and monitoring the border situation with our U.S. partners. The Prime Minister was very clear today, as he is every day, that we believe in acting out of an abundance of caution, that we believe it's very important not to squander the gains that Canadians have sacrificed so much to achieve. And we are going to be taking that prudent and careful approach when it comes to reviewing our border agreement with the United States. The premiers, very much including Premier Ford, offered some very useful input in the conversation on Thursday, and we're having ongoing conversations with the Americans.
I'm not sure that was an answer, but okay.
Yeah, no, Tonda, actually, that was an answer. What I said was that we are working closely with the Americans, that we're taking a cautious and careful approach. And we had a great and very useful conversation with the premiers who, by and large, share this cautious view.
So is there a need for tenfold increase in screening at borders, as Premier
So
Ford
when it
said?
comes to the second part of your question, actual measures that are in place at the border, right now the situation is working well. In fact, I think particularly at the Canada-US border, the distinction between essential and non-essential travel has managed to achieve our two objectives of keeping Canadians safe and at the same time allowing those essential goods and services to continue moving freely across the border. So that has worked and that is working. Of course, inevitably, as our economy starts to open up, something that we've been talking about today, even absent a single change in Canada's border restrictions, we will see more travel across the border. We'll see more Canadians choosing to go back and forth, and we'll see more business activity, which will mean more essential travel. And that does mean that the federal government will need to do even more at all of our borders to keep Canadians safe and well. And that is something that we are working on right now and we're very focused on.
Thank you, Deputy Prime Minister. We'll now go back to the phone for 3 questions. Operator.
Thank you. Merci. Our next question, notre prochaine question nous vient de Hélène Buzetti avec Le Devoir. Please go ahead. À vous la parole.
Oui, bonjour, Monsieur Duclos. J'aimerais revenir à la charge avec la question que vous a posée plus tôt mon collègue de TVA. Cette idée que, bon, on est en train de rouvrir l'économie, il y a des employeurs qui rappellent leurs travailleurs et il y a, dans certains cas, des travailleurs qui eux, personnellement, trouvent que ce n'est pas sécuritaire de le faire. Je comprends que vous invitez à avoir cette conversation entre travailleurs et employeurs sur la sécurité de travail, mais au terme du processus, si l'employeur et le travailleur n'arrivent pas à la même conclusion, que le travailleur veut toujours pas rentrer au boulot, devrait-il recevoir de la PCU, oui ou non?
Bien, merci pour la question. Et je le répète, la prestation canadienne d'urgence est là pour aider les travailleurs dans 3 séries de circonstances différentes. La première circonstance, c'est que si ce travailleur a perdu son emploi en raison de la COVID-19. La deuxième, c'est si cette personne a besoin de prendre soin d'un enfant à la maison. Et la troisième, si cette personne-là a besoin d'être à la maison pour assurer sa santé et sa sécurité. Et c'est là-dessus que la relation entre le travailleur et l'employeur est absolument essentielle. L'employeur a la responsabilité non seulement de garantir la santé et la sécurité du travailleur dans son lieu normal de travail, mais aussi de s'assurer que ce travailleur a le sentiment et l'assurance que cette sécurité et cette santé vont être maintenues. Mais dans tous les cas d'espèce, cette assurance et ce sentiment dépendent d'une conversation importante entre le travailleur et l'employeur. Et comme je disais, cette conversation peut avoir besoin d'être appuyée par les directives et l'accompagnement de gens comme la santé publique, des experts en matière de santé et de sécurité au travail partout à travers le pays, et certainement au Québec. Donc, ça dépend beaucoup des contextes individuels.
Bien, écoutez, je constate que vous répondez toujours pas à la question. Alors, je pense que je vais pas perdre mon temps à vous relancer parce que je vais avoir droit à la même chose. Donc, j'aimerais vous entendre sur la PCUE pour les étudiants. Le projet de loi adopté il y a presque 2 semaines de cela laissait une certaine latitude. On promettait dans la déclaration qu'on allait mailler les étudiants aux emplois disponibles, qu'on allait peut-être revoir le plafond de rémunération qui est permis tout en touchant à la prestation. Est-ce qu'il y a des développements sur ce sujet?
Bien, 2 choses rapides. C'est que, la prestation canadienne d'urgence pour les étudiants est une prestation qui est offerte dans un contexte beaucoup plus large, avec des mesures solides pour augmenter les disponibilités d'emploi pour les étudiants. On sait que beaucoup de ces étudiants vont avoir de la difficulté à se trouver un emploi. Ils aimeraient en trouver un plutôt que de recevoir la prestation canadienne d'urgence pour les étudiants. Et par conséquent, on a mis en place des mesures pour appuyer des stages, des mesures pour appuyer le travail bénévole, autrement bénévole des étudiants pour appuyer les organisations communautaires, les assouplissements pour le programme d'emploi Été Canada. Donc, une série de mesures qui vont être là pour accroître le stock d'emplois disponibles, mais il y aura des étudiants qui n'auront pas ces capacités de travailler durant les prochains mois. Donc, la deuxième chose qui va être bientôt faite, en collaboration entre Mme Leboutillier, ministre du Revenu, et Mme Qualtrough, ministre du Travail, c'est d'annoncer sur un site là, qui va être sur une page qui va être sur le site de l'Agence de revenus du Canada, les détails et les mécanismes pour que ces étudiants puissent recevoir la prestation canadienne d'urgence pour les étudiants.
Merci, Monsieur le ministre. Opérateur, prochaine question, s'il vous plaît.
Thank you. Merci. Our next question, notre prochaine question, nous vient de Laura Osman with the Canadian Press. Please go ahead. À vous la parole.
Good afternoon. This question is for, I think, Minister Hajdu and perhaps Dr. Tam. Some experts have expressed some concerns about the way Canada gathers important health data, particularly related to deaths that could be causing a delay in getting important epidemiological data, like excess deaths, for example. Death certificates are done on paper in some areas. So why is this process so behind in Canada, and is it hindering Canada's ability to gather that important data that other countries seem to have ready access to?
Yes, so we are in the process of looking at that kind of data with Statistics Canada because it's not just about COVID-19 deaths. It's also looking at some of the other impacts. So that is actually something that is taking place. As well, we are in contact with coroners and medical examiners to look at what they can contribute to as well. We started that building that capacity as part of our ongoing crisis in terms of drug-related poisonings and overdoses. So we are going to try and link with that platform as well. But it's a very important point, and there's a number of pieces of data that we're looking at right now to look at those in parallel or unintended consequences.
Laura, follow up?
Thank you. Other countries seem to have a more automated process for getting this kind of information. Is Canada's platform sort of behind the times on this?
Well, I think we have highlighted some of the gaps in sort of real-time information on the COVID-19 deaths themselves. So I think we are doing our very best with the provinces to try and see if we can address those gaps. So I think that's clear, particularly in the area of disaggregated analysis that we've already talked about, I think in the last several days. So that is something that we do have to work with. But I think with Statistics Canada, we'll look at some of the other statistical analyses. And, I think it's interesting in that the reporting of deaths is actually not that real time overall when you consider the fact that that's a very specific outcome. But it's something that we're looking at to see if there's different ways in which we can address that. But I think excess mortality is something that we have to look at right now in parallel with the COVID-19 deaths.
Thank you, Dr. Operator. Next question, please.
Thank you. Merci. Our next question, notre prochaine question, is from Alex Bollingal with the Toronto Star. Please go ahead. À vous la parole.
Hi, thanks for taking my question. I think it's for Minister Hajdu. We've seen, based on analysis by some of my colleagues in Toronto, that in Ontario, private or for-profit long-term care homes have had significantly more deaths from COVID-19 than public ones. I'm wondering what you think of that, and if in the reviews of our long-term care system and how we care for vulnerable people in Canada, if looking at changing the way that for-profit care is allowed, whether that would be bringing it into the public system, if that's something that you think should be looked at and done.
Well, thank you very much, Alex. And I think I've been really clear that there is this health crisis has really shone a light on some particular vulnerabilities in long-term care. And obviously, data is starting to emerge about certain characteristics of long-term care that have created even more risk for people that live there. I think our government is very open to reviewing how long-term care is delivered in this country and working with provinces and territories to strengthen quality of life and safety for seniors that live in congregate living settings. And I would say all congregate living settings, although there's a heavy focus on long-term care, there are other groups of individuals that live in congregate settings that also are vulnerable and have, in some cases, substandard care. I'm thinking people with disabilities, for example, or other special needs that may be supported in group settings. But in particular, in terms of long-term care, I don't think there is a minister amongst us that would disagree that we need to do a better job and that the federal government can play some leadership role in this. And we are having those conversations as we speak. How we, not only in terms of how we renew that system in the future, but also how we better support long-term care right now, regardless of how that care is delivered or under what model, to ensure that seniors are safer in their homes.
Alex, follow up?
Yeah, just does that what those discussions include looking at bringing them into public health care or bringing them out of the Canada Health Act? I know the NDP leader is calling for that. Would that be something that you guys are looking at?
I think right now the first focus is to get through the crisis and protect seniors who are in these homes, regardless of the model, in a much more robust way, working in partnership with provinces and territories. And that's exactly what we've been doing, as you know, whether it's through support through human resources. The military is actively involved, as you know. We're working with the Red Cross and supporting the Red Cross to deliver services through the provision of personal protective equipment or helping care homes to acquire personal protective equipment, etc. I think the longer conversation is what do we need to do collaboratively with provinces and territories to move from a place of guidelines to a place of standards. And I think that's the important conversation that needs to happen. I would say right now we are so focused on the urgent, immediate need to save lives in these places that we are not having the fulsome conversations about how to reform the system, but it's certainly on our mind. And I know that it's on the minds of the premiers of the provinces and territories as well, because as I said in my first response, this COVID crisis has shone a light in an area that needs dramatic reform.
Thank you, Minister. Ceci met fin à la conférence de presse pour aujourd'hui. Merci. Thank you.